Um, this is a new setup, so hopefully everyone can hear me. Julia, please let me know if you can hear me or not. So, what's new? What's been going on? There was a lot of hubbub on Twitter about Dr. Peter Hotez after Joe Rogan put him on, or Joe Rogan. He kind of called out Joe Rogan, and Joe Rogan then tried to kind of called him out. So I was kind of loosely involved in it or peripherally involved in it. If people don't know what happened, basically Joe Rogan was interviewing RFK Jr. A lot of that interview, most of it was about vaccines, and the fact that all of our vaccines on the schedule for children have not been safety tested against placebo. And he goes through a number of other things, about autism and the risk of getting that from vaccines, and the Simpsonwood transcripts. There was a meeting of government health officials held at Simpsonwood where they discussed the risk of autism from vaccines and essentially decided to try to cover it up. So anyway, he mentioned a bunch of these different things, and then Peter Hotez I think he linked to some defamatory Vice article that tried to debunk some of that stuff. And so Joe Rogan challenged him to come back on his show, because he's actually interviewed Peter Hotez a couple of times in the past. So he invited him to come back on and debate RFK Jr., Robert Kennedy Jr., on the topic of vaccine safety. And he actually offered him $100,000 to the charity of his choice. And then a bunch of other people piled on, including myself, adding to the pot. And eventually, at this point, the last I checked is like $2.7 million have been pledged by a bunch of people on Twitter. I think the highest one was $777,000 by a particular person, and then $500,000 by somebody else. A bunch of people pledged, $250,000. A bunch of people pledged 100,000, 50,000, 25,000, etc., all the way down to people pledging like $1 and $2.50 and stuff. But adding up the ones that appear to be legitimate pledges, you come up to like 2.7 million. And Peter Hotez is not going to debate for any number, any quantity of money to charity, unfortunately, or maybe fortunately, I don't know. But he would, I think, be destroyed by almost anyone in a debate on vaccines. Him and other people in the federal government who are in public health, they just really don't know much of the science. And it's really industry that writes the talking points. And so anyway, this thing kind of blew up for a couple of days on Twitter. I don't know where it's at right now. But, I hope that, Rogan has such a huge platform, probably the largest platform or close to the largest platform in the United States. And so there were other people in those tweet threads that were like, okay, I'll debate RFK in place of, Peter Hotez, since he's not going to show up. And hopefully he can find somebody to take both sides of the debate. That's something that I've actually been trying to do for years now. I've been trying to find people who are willing to take the pro-vaccine side of the debate, and I could not find anyone. I could not find anyone who was willing to do it. And, Steve Kirsch has also tried the same. It's very hard to find like intelligent, reputable people to take up that side of the debate. He ended up debating a couple of people, I think, on vaccines, but they just were not well prepared. I think one of them was actually a med student, and you could just tell me they were just kind of regurgitating the usual talking points without actually being familiar with the data. And so people on the other side of the argument, people who are, especially around COVID vaccines, arguing that they're dangerous and that they've killed more people than they've saved, are familiar with a lot of data, right? That is just not going to show up in the New England Journal of Medicine or in the Lancet or the British Medical Journal, the high impact journals. And that's one of the arguments that the pro-vaccine kind of crowd uses, is that, we're only looking at, high impact journal articles. We're not really interested. We don't really trust all the other stuff that's published. And the problem with that perspective is that the high impact journal articles purposely screen out anyone that publishes anything that would be negative for big pharma as an industry, because they are co-opted by by big pharma, just like our government is, and they make money, off of selling their journals to med schools and universities, and they primarily publish big pharma journal articles, and so the whole industry is kind of like interconnected, inextricably just intertwined, deeply intertwined, and big pharma pays most of the advertising fees on mainstream media. It publishes most of the journal articles in those journals and advertises in the journals to physicians. Then the journals sell their subscriptions to both physicians as well as med schools, and they kind of, they don't even need to sell them to physicians, right? Because the advertising is paying for that. And so I keep getting like journals in the mail for free, and they keep asking me to subscribe, but I've never subscribed, and they just keep sending them every month, and they keep going to the trash can because I don't trust those things anymore. So anyway, just a brief kind of rundown on that, and still, I am looking for people. I would love to get a debate like that, and perhaps me be the moderator. I would love if Joe Rogan could do it, because it'll reach a lot more people. Hopefully, it can be done well. You don't want it to be like rhetoric, right? Like, if somebody is good at debating, they can win either side of the debate, right? And they may not be right. So you want to kind of have some sort of like rules in place, or some way to make it more fair, so that it's not all based on whether somebody can argue well. Because there are interesting things to get into. I would love to have like somebody who believes that viruses don't exist debate a virologist, right? And just hash it out, take as long as you need, and admit, where you're wrong, or where the science, has maybe skipped some steps, or where where there's deficiencies in our knowledge base, right? So there's just some things that we can't feasibly do, with the technology that we have. And so we make assumptions, right? But we should be clear on where those assumptions are and what they are. All right. So, and I truly believe that if people who are deeply versed in like the hard sciences look at the medical, quote unquote, sciences objectively, they would oftentimes be shocked at how things are done. Right. It's not very scientific usually. And another great tweet thread, I retweeted it. If you guys aren't following me on Twitter, check it out. It's at Dr. Syed Haider on Twitter, DrSyedHaider. But anyway, I retweeted Chris Masterjohn, and he was just explaining a couple of times, I think today and yesterday, and where he was explaining how a lot of the vaccine research is actually done. So he goes into a little bit of detail on the vaccine research for, I think it was polio. Yeah. He basically points out that the way it's designed, most vaccine research is designed, and this is the same thing that happened with COVID, and that he goes into more detail in it in the tweet that I retweeted today. So basically, the studies are structured in such a way, and this is what vaccines seem to do. So vaccines all that they seem to do is make you test negative for the disease that you're being vaccinated against. But you can still get either the same disease or a disease that looks exactly like it. And the only difference between you and somebody who tests positive is that you're testing negative, right? So hopefully that made sense. I mean, it's basically, this is what happened with the COVID shots. What they seemed to do was make it so that you tested negative for COVID, but you could still be hospitalized with a COVID-like infection and die from it, and actually at higher rates. That was in the beginning. Now they actually seem to make you more prone to actually get infected with the newer variants of COVID. It's like even that initial fake out, right? So it used to be that although you tested negative, you ended up being hospitalized or being sick with like something that looks exactly like COVID. And so they shift people from being hospitalized with a COVID-related illness to being hospitalized with a non-COVID related illness, but like the same illness, right? It looks exactly the same. And unfortunately, they also kill people from other things. I mean, one of the patients in the Pfizer trial died, I think, the day after their first shot from a heart attack with no history of heart disease, right? So it seems that they do kill people from heart attacks at a higher rate. And so there was higher all-cause mortality in the Pfizer trial reported, although it didn't reach statistical significance. I mean, it was quite concerning, right? I think it was 4 or 5 more people died in the vaccine arm than died in the placebo arm from other things, not from COVID. So in that trial, you were less likely to die with a quote unquote COVID diagnosis or a positive PCR for COVID, but you were more likely to die from other causes, including especially heart attacks. All right, so that's a little bit about what's going on in the world, and some stuff that I've been doing lately, looking into rape. I also tweeted about this. Chris Masterjohn did a 45-minute webinar or whatever and he posted it on Twitter, where he goes into how one of the people that he was consulting with had a lot of issues, rashes, and I think pain, and all kinds of like issues, health issues. And he thought that was due to too much omega-3 fats. So like she had been supplementing with high doses of omega-3 fatty acids for years, I think maybe 10 years, if I remember correctly. And his theory was that it was interfering. I don't clearly remember the whole thing. I have to go and watch it. I didn't watch all of it, but it was quite interesting. He was thinking interfering with arachidonic acid metabolism, I think was the point. And so anyway, he took her off of omega-3s, and symptoms have started to clear up over the course of a few months. And so I kind of rabbit hole and came across some of the stuff Ray Peat has written, and he has also argued that not only omega-6s but also omega-3s are bad for us, that we shouldn't be eating fish or fish oil or EPA or DHA, which is, quite a startling, thought, because it's so deeply ingrained in me, and I think most people, even in like alternative medicine space, that fish oil is so good for you. So anyway, I tweeted out a few of his articles, which I'm still going through myself, to understand why that might be the case, and trying to figure out where, it depends on the person, right? Because you go to different diet gurus and they all say that like this is the diet for the human being. That doesn't seem to be, it doesn't seem to make evolutionary sense, because people evolved all over the world, right? And they had vastly different diets in different parts of the world, and they seem to do quite well on very different diets. I mean, there are people, Ray Peat is kind of like, oh, sugar's not bad for you. You can eat sugar and, don't worry about it. It's actually good for you if you fix your metabolism, right? If address stress and other things and your sugar metabolism normalizes, the sugar itself isn't bad for you, which kind of makes sense from one perspective, because there are cultures that eat a lot of carbs, which are essentially sugar, right? So even whole food carbs get converted into sugar in your body. They are not absorbed as fast, and they don't hit your bloodstream as fast as pure sugar does. But regardless, they are 100% sugar, right? Like bread is sugar, and potatoes are sugar. They're starch, and they break down into single sugars in your body. But some cultures did great on high carb diets, and other cultures did great on extremely low carb or almost no carb diets. And some of the African tribes and perhaps the Eskimos are included in those. So I think it would be better to try to figure out. And the other thing is that I would assume there were cultures that ate a lot of fatty fish, right? And were like optimized for that. But the idea here is that omega-3 and omega-6 polyunsaturated fatty acids are very heat sensitive and oxygen sensitive. So they become oxidized very quickly. And so his argument is that as soon as you eat them, right, even if you're eating them from a whole food, from like you're eating salmon, or sardines or mackerel or any of these fatty fish that are considered healthy. In the fish itself, they are kind of preserved. There's a lot of antioxidants, other things that keep them, from oxidizing, going rancid, especially when the fish is alive. But then once you eat the fish, immediately, once you break them down, once you, absorb them, they go into your bloodstream. Basically, right away, they're oxidizing and becoming rancid because your body is very hot, right? Compared to a fish. Fish are very cold. Your body's very hot, and it breaks down those fats and makes them rancid, and they become oxidized because there's a lot of oxygen in your body also. And then they just do damage. They do a lot of damage, supposedly, according to Ray Peat. If that's true, then maybe you don't need so many. And some people think that, they're essential fatty acids. This is kind of like the common view, the traditional view, is that they're essential because our body can't make them. But other people argue that maybe your body can make them. We just don't really understand how it makes them. So one of the main concerns, and I think Chris Masterjohn shares this concern, is, for example, babies, when their brains are developing, they need DHA. And part of that presentation he gives, that 45-minute presentation, mentions this, that the patient that he was evaluating was thinking to get pregnant. So he was like, well, take DHA. The other reason this is interesting is because he was saying that the EPA is actually more harmful than the DHA is. And it's because the EPA, I don't remember what it was. I think I wrote it down. The EPA interferes with arachidonic acid in a way that the DHA does not. But the reason I find that interesting and confusing is that Big Pharma, they produced an EPA only product, and my understanding was that the DHA is more sensitive to oxidation than the EPA, and there was some reason to believe that EPA would be even more beneficial than EPA plus DHA, which is usually what fish oil is. Fish oil is usually both of them together, not one or the other. So there are drugs that have been, they're not drugs, they're basically just fish oil, but they are, they're prescribed, and you have to get them prescribed, that are EPA only. You can buy EPA that's been isolated. So Vascepa, for example. And a lot of people have found that it works really well, at least in the short term, to get them better from long COVID or from vaccine injuries. And so from Ray Peat's perspective, and I think Chris Masterjohn also is kind of talking about this, they have an anti-inflammatory effect initially on the body. So there's a short-term anti-inflammatory effect, and then you get exposed to the longer-term, inflammatory problem because they're oxidized and they're turning into, some of their metabolites have inflammatory effects. So they have some of their metabolites have prostaglandin-like effects, which prostaglandins are inflammatory molecules. So they degrade or get metabolized into inflammatory molecules. So initially they will have an anti-inflammatory effect, the EPA, especially, but also mostly, I think the EPA especially has that anti-inflammatory effect, preventing, I think, the conversion of arachidonic acid into prostaglandin E2. So prostaglandin E2 is inflammatory. But later on, they will themselves break down into inflammatory products that that cause inflammation. So this is kind of like throwing me for a loop, right? Like I'm still looking into this, trying to figure out whether I should stop telling people to take fish oil because it may cause them harm in the long run, or whether you need to figure out which people would benefit from fish oil and which will not. One of the things I still don't understand is, one of the theories for why we should have more omega-3s was that traditional hunter-gatherer cultures supposedly had much higher levels of omega-3 to omega-6 fatty acids in their bodies. And that might be because the omega-3s are broken down when you're in an inflammatory state. They get more broken down and they get used up. So anyway, unfortunately, you can't always get to an answer that's provable. Sometimes you have to make some leaps of logic or reasoning because there's missing information, missing data. We just don't have the data. So anyway, I'm going to try to get Chris Masterjohn on an interview and get into this in a little bit more detail and try to understand who should be taking omega-3s and who should not, and where you should get them. Because if he's suggesting that DHA alone is healthy, I mean, how could any, ancestral humans, I mean, how could we have in nature ever gotten pure DHA without the EPA? I mean, it's doesn't seem possible to me. All right, so now I'm going to go to your questions. All right, so Georgianne says, omega-3, 4 grams, stopped my PVCs in 2 days. Yeah, I mean, a lot of people say that the omega-3s help them. And again, they have an acute anti-inflammatory effect. That's for sure. That's not in doubt, right? So they do have an anti-inflammatory effect immediately, but the point here is that they may have a negative effect later on. And some people swear by EPA. I mean, Dr. Pierre Corey, his partner, they swear by using the EPA-only prescription version. They say that works a lot better. And some of my own patients have agreed. The research is kind of conflicting on which one is better. Actually, all of the omega-3 research is very conflicting because they have followed tens of thousands of people and seen no benefit of omega-3s. But then some of the pharma-funded trials obviously showed a benefit of EPA, but I don't really trust them. So anyway, knowing that omega-3s don't have a short-term inflammatory benefit, they do. The problem, the issue is that offset by harm later on. I had urine organic acid testing and mineral testing, low in zinc, copper, B12, vitamin C, omegas, lithium, taurine. I have malabsorption. Travis says, what can be done to alleviate the lingering cough, perhaps caused by postnasal drip and mucus that have dominated my life since having COVID? So the lingering cough, the first thing that you got to do is you got to do breathing exercises. And I've talked about this before. I talked about this last time, I think. And I learned this from Michelle Harvey, who's our health coach. I did not learn this in med school. I wish somebody had taught me this, but they didn't. And what she said, and she did some research for one of her presentations that you can probably find on Rumble, and maybe even, I don't think it showed up on my Twitter feed, but it should have. We tried to stream it to Twitter. But anyway, Rumble, Dr. Syed Haider, I think, or Dr. Syed Haider on Rumble. So she discovered that just 4 days or less of disordered breathing during like a infection, for example, can basically create a new like neurological habit for your breathing. And that could set people up for persistent shortness of breath or persistent cough or just persistent breathing problems. And there are a bunch of anecdotes from people, including Chris Masterjohn, actually, who had persistent cough for like a month after his COVID until he started doing some simple breathing exercises, and then the cough was gone within 24 hours. So it may just be that you've laid down these new neural pathways that are causing your breathing to be abnormal and making it so that you cough. So coughing after a viral upper respiratory infection is really common. I mean, people will cough for like months, and then it eventually just wears off and it goes away and they get back to normal. And what we've usually attributed that to was postnasal drip, right, as you said, or just like, I don't know, irritation or something. Like, we don't think it's a persistent viral infection. And we tell people to try antihistamines or just take a cough suppressant and just wait it out. But I think the number one thing that you need to do is try breathing exercises, deep breathing exercises, belly breathing exercises. There's a number of different ones. And if you try a few of the ones that we recommend, so like 4-7-8 breathing, you don't really do it that much. You just do like 4 breaths, maybe 4 or 5 times a day. And Andrew Weil has a great video on YouTube of that. The Wim Hof breathing, you can use that. You can look up other pranayama breathing methods, and you can try box breathing. You can try, so there's a number of different breathing methods from yoga that can be tried. And if you're still not getting better, then what I would do is learn Buteyko breathing. So Buteyko. That's a specific form of breathing that's been found to be really amazingly helpful for resolving people's asthma. And if it's not the breathing pattern that's the issue, if it's not like the wiring from your brain to your lungs that's the problem here that's triggering the cough, then it could be a histamine related problem. So you may have too much histamine, and that could be a postnasal drip issue. And that's not really a lung issue. It's more of like a throat getting irritated issue, and the cough is like from that throat irritation. It's like you feel it up here, right? So antihistamines are worth a try too. And so some people get better within days of starting an H1 and H2 blocker. Some people need to do a combined H1, H2 blocker like a Benadryl or promethazine or one of the other prescription antihistamines. So that's worth a try. And if the initial starting doses don't work, you can increase the doses, maybe take them twice a day. So what would that look like? It would be like Claritin and Pepcid, or Zyrtec and Pepcid, or Allegra and Pepcid. You might start them at once a day, and then you might try them twice a day or 3 times a day. And if you're noticing a little bit of benefit but not a lot, then maybe try Benadryl instead. For some people, the H1 and H2 blockers don't work well. They have to use Benadryl, and that works great. So that would be the next step, try Benadryl. And this is all assuming other things are normal, like, right, you've done a chest x-ray and maybe a CT scan, and there's nothing wrong with your lung tissue, right? And your oxygen levels are normal. If that's not the case, then there might be a problem in the lung tissue itself, and in which case maybe a spike protein related inflammation problem, or a persistent virus problem, or something like that, in which case you might need to address that, right? So you might need to clear your body of spike protein with something like augmented NAC from vitahealthapothecary.com, and nattokinase, and maybe ivermectin, and maybe you do nebulized iodine hydrogen peroxide, you even nebulize heparin to relieve whatever inflammatory process is going on. So Todd says, "Hi, Dr. Haider. I'm suffering from 17 months with long COVID, really horrible fatigue and some shortness of breath and post-exertional malaise. Is there hope at some point I can get better?" Absolutely, there's hope. I've tried so many supplements and meds and treatments, and so far nothing has helped. Have had to go back to work after a year off, and I'm struggling. So what I want to mention here is that what I would recommend, the number one thing to do, is address the mind-body connection. So the mind can control and get rid of essentially all symptoms, right? So, yogis who train for years, they can burn themselves without feeling pain. They can control their heart and their breathing, and they can, turn off pain or turn it back on, and they have incredible control over their body, right? So I'm not saying that you have to study for years to become a yogi to be able to in your shortness of breath and your post-exertional malaise and your horrible fatigue and any other symptom, back pain, muscle aches and pains, brain fog, loss of taste and smell, tinnitus. There's a lot of symptoms that come with long COVID. What I am saying is that there are methods that you can learn that work very quickly to address all the symptoms. And they don't necessarily correct immediately the underlying abnormalities of like the spike protein and the cytokines and microclots and all of that. It's not like those things disappear immediately, but the symptoms can go away within hours or days, right? And so the one that I'm most excited about, the mind-body therapy I'm most excited about right now, is called the lightning process, and you can find it at lightningprocess.com. It's Phil Parker's creation, and he's been very successfully treating or showing people how to treat their own chronic fatigue syndrome for 20 plus years. And over the last couple of years has had tremendous success dealing with long COVID. So spike protein triggered diseases and you can see some of the testimonials online where people had like severe fatigue or brain fog or whatever, and it just clears up within days. And so the way it works is you do there's like 5 hours of content that you get for like, I think $20 that you can download. And you're supposed to watch that. And then you're supposed to, register for a 3-day seminar, which is a lot more expensive, but, something like $700 or something like that for a 3-day seminar, depending on where you take it. There's a bunch of people who do this all over the world. You can do it on Zoom, you can do it in person. So anyway, you take the 3-day seminar and they teach you exactly how to do this lightning process. So the 5 hours before the seminar is just to kind of like understand, I think, the basics, how mind-body connection works, and kind of convince you of the fact that there is a mind-body connection, and that the mind is very powerful and it can create or reduce or eliminate symptoms on its own. And then the seminar is meant to actually train you how to do the lightning process and get rid of your symptoms. So people take the 3-day seminar. During the seminar, a lot of people get better, and then in the days following the seminar, a lot of people, their symptoms just disappear. And things like tinnitus, brain fog, chronic fatigue, loss of taste and smell, like all the symptoms of COVID can vanish. She's also treated other serious problems like multiple sclerosis and cancers and a lot of different things. So I've interviewed him, and that interview should be going up on longcovidreset.com soon. And so we'll be announcing when that stuff goes up. But in the meantime, I basically recommend people try something like that. The reason I'm excited about that process is that, I've recommended people go and try EFT or NLP, or retrainingthebrain.com has something that's like a few month long, educational program. The Dr. Gupta protocol, people have reported that helps, but nothing works as fast as the lightning process. I think that's why he called it the lightning process, right? Like, it's very, very fast. And so yeah, Julia, I'm not sure if, we might just be launching it at longcovidreset.com. Yeah, and I think right now it is at pro.longcovidreset.com. Eventually we'll be launching it we may be replacing Long COVID Reset with the pro version. So we haven't decided yet. All right, so yeah, that's the first thing I would do, Todd, is I would look into mind-body therapies, and then, and those can relieve all of your symptoms, okay? Number two, lifestyle changes and other things like breath work can relieve your symptoms as well. And there's a lot of different approaches that have worked for a lot of different people. Intermittent fasting has worked, supplementation has worked, augmented NAC has worked really well for a lot of people. It clears out the spike protein. Nattokinase helps to clear out the spike protein and the microclots. So these are some things, and then just optimizing nutrition, right? So you want to get rid of the spike. At the same time, I think it's very helpful to get rid of glyphosate from your body. The way to do that is take some sauerkraut juice with meals, maybe a quarter cup, maybe an eighth of a cup, just a little bit. And then away from your meals and your supplements, have fulvic acid and humic acid and activated charcoal. That helps to get rid of the glyphosate. And there's in the upcoming summit, which should be released in the next, hopefully, month or so, I have an interview with Stephanie Seneff, and if you haven't heard her talk about glyphosate, you really need to hear her talk about glyphosate. It's very convincing. She's published a book on it too, which I highly recommend getting. And her contention is that, really everything that's gone wrong in human health in the last 50 to 100 years is linked to, or 50 years, is linked to, chemicals in the environment, and especially glyphosate. Once glyphosate was created in whenever it was, 70s, 80s, it really triggered worse things. So things that we used to be able to tolerate, including smoking, and alcohol, and, people 100 years ago would smoke and they didn't, have the same reaction that we do. They didn't get cancer at the same rate. At least it doesn't appear that they did. So anyways, she thinks that, this obesity epidemic, the chronic disease epidemic, diabetes epidemic, all these different epidemics are really linked to glyphosate, which makes you far more prone to, so it's not that you can't fix them without getting rid of glyphosate, but if you get rid of glyphosate, if that is the root cause, then all the other things that we attribute these problems to, like eating too many carbs or not exercising enough or whatever, we become far more resistant to becoming sick from those things, right? So I think that's her main point, that people used to be able to tolerate all these other things that we have to be really strict about now, right? In order to be healthy now, you have to like exercise and eat right and fast and sleep well and do all these things, right? That she would say that like people in the past, they were able to do all the same things wrong that we're doing, and yet they weren't chronically ill, they weren't obese, they weren't, asthmatic, they didn't have all these problems. And she thinks that it's the glyphosate and perhaps other, toxins in the environment that really made the biggest difference. So anyway, I think it's clear that glyphosate is harmful at this point. There's a lot of research on pesticides. You're not going to see it in the mainstream media, but it does exist. And if you want to learn more about it, read her book or listen to some of her talks. And basically, I think the point is to become convinced that it's harmful and then become really strict about avoiding it as much as possible. So all organic, no eating out. That's the main thing, because if you eat out, you're going to be exposed to pesticides. The organic industry in the U.S. is kind of as it is, but it's the best that we have, and it's the best way to avoid pesticides. Eating only organic. Second best would be the clean 15 foods and avoiding the dirty dozen foods. You can look those up. So hopefully that was a start of an answer. Protocol on our website, mygotodoc.com. You scroll down towards the bottom. There's a bunch of protocols, including long COVID protocol that shows all the lifestyle stuff, supplement stuff, and medications that you can try. And the important thing is that there's something in there that will work for you, but I can't always predict which thing will have the most effect on which person, right? There's just no good way of predicting that yet. So people who have the same exact presentation as you will get better from something that won't help you, right? And you'll get better from something that might not have helped them. So you just got to maintain the faith and be patient, and you will get over it. And the mind-body connection is extremely important. It can relieve all of your symptoms. Chelsea says, any thoughts on zeolite powder when it comes to detox? So what is zeolite powder? Is that the one with potassium in it? It looks like aluminum, silicone. I'm not sure what zeolite powder is. Let me see. No, I think this is something different. 100% natural volcanic mineral powder. Yeah, sounds interesting. I don't know about it. Yeah, I don't know anything about zeolite powder. But yeah, we'll look into it. Chanel says, "How do you do about hair loss? I've noticed since post falls out so much." So, with everything, including hair loss, there are two things going on: toxins and our lack of nutrients, right? So we have a great hair loss kind of like supplement at my go-to stack. It's called Rebuild, maybe something hair. Let me see. Rebuild Hair Fair, I think it's called, something like that, right? Yeah, Rebuild Hair. So it's got all the micronutrients that you need, as well as some herbs that are better regrowth. That's half the battle, right? Is nutrition. And nutrition starts with food, right? It doesn't start with supplements. It starts with your supplements or supplemental. And then the more thing is to get the issue that triggered that to start, right? So nutrition was optimized. That thing, the hair loss, may not have been able to trigger the hair loss. Hair loss starts, you should address both things. You should address the nutrients, which, a lot of the ones that were important for hair were probably depleted by COVID. So when you get sick, your body burns through a lot of, essential nutrients, and you can become low in them. And then, but the trigger also needs to be, addressed. So that is spike protein. So one of the best things that people can do is check a LabCorp semi-quantitative SARS-CoV-2 IgG level. So it's an antibody level to the spike protein of SARS-CoV-2. So check out for that and see where it's very and you probably don't have much spike protein or any spike protein left in your body. But if it's elevated, you know that your body still has spike protein around in it, and it's reacting to that to keep the antibody levels high to the spike protein. So if the antibody levels are high, it means the spike protein levels are high, and you still have work to do to get rid of it. Augmented NAC from Vita Health Apothecary, I have no connection to them. I'm just saying it because Pierre Corey and his partner and a lot of other people, including Tina Piers in the UK, very reputable people, have found that it works much better than regular NAC for their patients. So augmented NAC, nattokinase ivermectin, and possibly some other things. It depends, right? So if that's the only symptom, then the best way to probably track improvement would be with the semi-quantitative spike antibody levels. But if you have other symptoms, then we can kind of track whether those get better and try to improve those as well, as and assume that if the other better, your hair loss will eventually recover. But the issue with hair loss is that it's very delayed, right? So you could recover from everything else, and then it takes 6 months for your hair to regrow because the follicle life cycle. So that's important to remember, that it's going to take some time to see the hair recover. And I have seen people recover the hair loss. It does happen. So it's not the case that once it thins or you lose it, it's over. Anil says, I'm having sore throat and burning and at times difficulty in deep breathing for the past 2 years. Yeah, so I highly recommend breathing exercises. So that's probably all you need. But if it's gone on for so long, you probably need to do a chest X-ray and possibly a CT scan of the chest just to be sure that there's nothing else. Hopefully you can avoid the radiation from a CT scan, but sometimes get somebody to listen to your lungs and possibly do a chest X-ray and just if all else fails, you need to address, make sure there's nothing, not an inflammatory process going on in your lungs themselves. But the most common reason for this is misfiring of neurological pathways. The habits of your autonomic nervous system have been rewired, and they've gotten more and more deeply ingrained because it's been going on for 2 years. But the fact that you can change the habits in a negative direction in as little as 4 days means that 4 days of you would have to breathe properly for 4 days straight for this to work, but as little as 4 days total of breathing properly could rewire those pathways and make you able to breathe normally again. It makes me think that we need to have 4-day breathing seminars for people and just have them breathe all day long, right? It would get boring fast, but people have gotten better without doing. You don't have to breathe correctly all day, every day, to get better. But so it's easier to get sick and to mess up your breathing than it is to improve it, because the disordered breathing is automatic. You don't have to think about it. Anil said, okay, so yeah, the sore throat and burning. Yeah, so I'm assuming that this is a spike protein issue, since that's basically what we're talking about here, COVID or vaccine related. So yeah, I mean, the approach here, I don't know of any specific thing that's going to fix your sore throat, right? You have to wonder, what exactly is it that's causing the sore throat? Is it histamine related inflammation? Is it just spike protein related inflammation? Is it a postnasal drip, which would probably be related to histamine? So the most common things are histamine, and if you take an antihistamine and get better, then that's pretty good. There's a pretty good case to be made that it was kind of an MCAS type of thing, so that might be something to try. And again, mygotodoc.com for the full long COVID protocol. Basically, I recommend everyone just do the full protocol, right? And I would also recommend that you go and do the lightning process, and it can relieve really any symptom. Again, the mind is so powerful that it can relieve any symptom. And I would assume that once the symptoms are relieved, eventually the underlying cause for it would also heal and be cleared out. But yeah, so you're basically one giant mind. right? So the mind extends everywhere in the body. The consciousness of the human being extends throughout the body. It's just that the connections get slower outside of your head, and in your muscles and bones and stuff. The propagation of information is a lot slower among other cells than it is amongst neurons. But everything is, deeply intelligent. Every cell of your body is deeply intelligent um, and can communicate, right? So with your subconscious. So your subconscious and your mind, can control every cell in your body. It can control all the immune system cells, all the cells, right? So they are controllable by this, which means that you can fix essentially the symptoms of any disease using this if you learn how to do it. And apparently it's not that hard to learn. So, take the 3-day seminar and report back to me. Hi, Dr. Haider, what can help head pressure and my body also has a burning sensation? This sounds like histamine, it's pretty common histamine type of symptoms. So that would be kind of the place to initially focus on. Underlying issue is usually spike protein. And so you want to also focus on getting rid of the spike protein. I have S1 in non-classical monocytes still. So the S1 subunit of the spike protein is in your non-classical monocytes. I've been tested by IncelDX. My symptoms returned after months of feeling okay. Would ivermectin help or another medication? Ivermectin is kind of the go-to first thing along with low-dose naltrexone that I think a lot of us are using now. And that's where I would start for basically everyone if they're not willing to try mind-body like lightning process or lifestyle stuff. If you really dedicate yourself to the lifestyle and mind-body approach and nutrition and maybe some supplementation, you can probably fix this. Most people can probably fix it. If you can't dedicate yourself to that, then certainly, ivermectin and low-dose naltrexone and other over-the-counter medications as well, like the antihistamines, would be a good place to start. So the entire protocol is there at mygotodoc.com. Carla says lumbrokinase works better on me. Will it degrade microclots as well as nattokinase? Yeah, I think lumbrokinase should work just as well, but I don't have any proof of that. Supposedly it's stronger at breaking up clots than nattokinase is, but I don't know that lumbrokinase has actually been proven to break up these microclots in a lab setting or in a person, and also whether it breaks up spike protein, because nattokinase is known to break up the spike protein. I don't know that nattokinase has been shown to break up the microclots, though. So that's kind of perhaps an assumption that it's helping break up the microclots. Carol, but yeah, if nattokinase doesn't work well, you might want to try a different. I'm not sure what that means. Like, do you react negatively to the nattokinase, or just you feel like the symptoms get better with lumbrokinase? But either way, whether it's either of those, I would try maybe a different brand of nattokinase, because nattokinase may have some, fungal contamination, because so fungal contamination because it comes from soy, and the soybeans might have been contaminated with fungus. It's just a problem with, beans of all kinds. Or you might have a problem with soy itself. So it is just a product that comes from soy initially, and so there will be, no matter how much you try to purify something, you can't completely purify it. So there's always going to be a little bit of the source kind of like material that it came from left over. So if you have a problem with soy, then maybe that's why you don't tolerate nattokinase. But if it's a fungal issue, then maybe just a better quality one that doesn't have that fungal contamination. I don't know if any of them are better than others. So Brandy says, what can we do to help our bones with this as far as reducing inflammation? Would ivermectin help level that out with the stomach? Not sure what this means. So for bone health, you need, obviously you need calcium, and you also need vitamin D, and you need vitamin K2. So vitamin K2, your vitamin D helps to absorb calcium from your diet. And so you need to optimize your vitamin D levels. And the way to do that is you check your calcitriol, which is a D3 activated form of vitamin D in your body, with a parathyroid hormone and with a calcium level, which comes on a complete metabolic panel. And basically, the calcium level in the blood should be normal. You should raise the vitamin D month to month and see the parathyroid hormone start to go down. Once the parathyroid hormone stops going down, you know that your vitamin D was optimized. And so you want to keep it at that level that was required to make the parathyroid hit the kind of the floor and stop going down. So it completely suppresses parathyroid hormone release. So these, D and parathyroid and calcium are all interlinked in the body and interrelated in their functions. And so that's one way of optimizing vitamins, which is very helpful for long COVID vaccine injury and autoimmune diseases and a lot of different problems, including cancer. But just for general health, optimize the vitamin D. And then the K2 is required to shuttle the calcium to the places it needs to go to, like the bones and the teeth. And so you need to, and some people find that their symptoms get a lot better when they take very high doses of K2. So in Japan, they've studied like mega doses of K2, I think as high as like 45 milligrams. Usually we use micrograms of K2. So like tiny doses compared to the higher doses that have been used. So you might want to experiment with higher doses, like in the gram range, in the milligram range, not the gram range, the milligram range of K2, like a milligram, 10 milligrams, in that range to see if it improves some of your symptoms. And you got to be careful whenever you're supplementing any of the fat soluble vitamins, which are vitamins A, D, E, and K. K comes in K1, K2, and a bunch of subforms. But anytime you're supplementing A, D, E, and K, you need to probably supplement all of them because supplementing one can lead to deficiencies of the others. So that's what you can do for your bones, as well as weight-bearing exercise is really important for the bones, especially women and men as you get older. Very important to do weight-bearing exercises because that's what tells your bones that they need to be there. They need to be strong. They need to maintain themselves, is putting some stress on them. So exercise, but especially weight-bearing exercise. Ivermectin, I'm not sure what the stomach is there for and what you mean by that, but ivermectin in general can help with inflammation as well as spike protein detox. Brandy says, most of my symptoms went away. It's just lingering in my bones with inflammation, cracking. Have bone cysts in the left wrist, maybe? So if you have cysts in your bones, like they've actually seen something abnormal in your bone, that's concerning. But the pain itself may be in the bones, or it could be in the connective tissue network. So pain, it's hard to tell where it's from. Like I get headaches right here, but they come from back here, right? So if I massage back here, the headache here goes away. So there's a lot of referred pain, and your brain misinterprets the source of the pain quite often. So the bone pain, it might not be in the bones. It might be, but it might not be. It could be in the connective tissue around the bones, and maybe the connective tissue is weak. Maybe the muscles are weak, and they're not creating like a strong enough framework for the bones. And so muscles and bones go together. And bones and joints will not be properly supported if what's surrounding them is not as strong as it needs to be. So not just the muscles, but also the tendons and ligaments. So ligaments are this connective tissue, bone-to-bone connective tissue, and tendons are muscle-to-bone connective tissue. So yeah, I mean, I guess the one thing, if this is spike protein related, get a LabCorp semi-quantitative spike IgG level or SARS-CoV-2 IgG level, antibody level, and make sure that that's really low. And if it's not, then you need to do some more work on getting rid of the spike protein. And this is a good time to remind people that you may do everything right and still be sick because other people around you are shedding. So if there are people in your home that are shedding or that might be shedding, like if they've ever gotten a shot, or even even if they didn't get a shot, right? Either way, they could be shedding, right? They could have like a long COVID issue that they're not aware of. They have no symptoms. They're asymptomatic, but they have a lot of spike protein. They're shedding it too. Or they got the shot, and I mean, some people think that shedding never stops after the shot. I hope it does, but some people think that it may not. So maybe get them tested too, and see whether if their spike antibody level, their semi-quantitative, SARS-CoV-2 IgG level from LabCorp is elevated, then they may need to treat themselves with an anti-spike regimen like augmented NAC and nattokinase to help you. Jane's, and this has been the case for some people. Jane says, is there a way to diagnose if someone has a histamine intolerance? Yeah, I mean, it's mostly a clinical diagnosis, but there are some tests that can be done. You can check your histamine levels, for example. You can check levels of eosinophils. They can indicate an allergic, disorder as well. And there are probably other tests. I'm not like a histamine expert. So, Julia, ask Shalb to look into all the tests for MCAS or histamine intolerance. But the main thing is it's mostly a clinical diagnosis. So my son has been on a low histamine diet and takes Pepcid and Zyrtec, but has seen no change in his daily frontal headaches. Could the headaches be an inflammation of another type? Yeah. So histamine is just one of the causes of headaches. There are many other causes of headaches. People become sensitive to dairy or to, not getting enough sleep or to stress, or, there can be tension headaches, they can be due to muscle tension in the neck. So headaches, it's a big topic. I think all topics are big. The deeper you go into them, the bigger they appear. Headaches are one of the easiest things to fix with mind-body medicine. So lightningprocess.com. I would highly recommend that he takes that 3-day seminar. And again, headaches are some of the easiest things to fix. Chronic pain in general, people think that it's the hardest thing to fix. If they learn the right mind-body approach, it's very easy. If you know how to do EFT well, usually you have to have somebody guide you through it. Like you can learn how to do EFT in 5 minutes. And if it works for you, great. But if it doesn't, it oftentimes does work if you find somebody who takes you through the process and is able to do it well, properly, and just has more experience with how the different variations, right, that you can use with the EFT. It's a very simple technique. Again, you can learn it in 5 minutes. It's probably the simplest mind-body technique to learn, and it works oftentimes very well for pain, but sometimes you can't make it work, right? So I had sciatica, which is another thing that's very easy to treat with mind-body medicine, and I did EFT and it went away, but then it came back and then the EFT didn't work. And so there was something else there that I couldn't figure out, to do with the EFT that may have worked if I had been able to figure it out. So that's the thing with a lot of these mind-body approaches. You can go so far and then you have to have somebody help you. And that's a little bit different apparently with the lightning process. It doesn't really need people to help you once you learn how to do it. The process itself or the technique itself is powerful enough that it works without a lot of adjustments from a practitioner. But they could still be related to histamine as well, right? So there's a bit of saying you're on a low histamine diet, may not actually mean you're on a low histamine diet, because you can react to foods that don't have histamine in them, or that for other people might not release histamine, but in your body they release histamine because you have become allergic to that specific food. So he may not actually be on a low histamine diet. Maybe he's not taking enough Pepcid and Zyrtec. Maybe he needs to take prescription antihistamines. Maybe he needs to take Benadryl. Maybe he needs to take Cromolyn with meals. Maybe he needs, Singular. Maybe he needs stronger antihistamines. And then his headaches would go away, and then that would prove that it's a histamine problem. But even if it's a histamine problem, the mind-body approach still works. So regardless of what the underlying cause is, mind-body medicine can fix the symptom. And And I don't think it's just a band-aid. I think once you fix the symptom, the underlying thing will resolve, although it won't resolve immediately. So the histamine intolerance would also resolve, or the excess histamine levels would also resolve once the symptoms go away. Joshua says, Dr. Haider mentioned on his last video that Dr. Corey uses spike antibody testing to track long COVID vaccine injury. Which test is he using? So the test that I've been repeating over and over again. SARS-CoV-2 antibody total spike semi-quantitative, or SARS-CoV-2 antibody IgG spike semi-quantitative. SARS-CoV-2, so it's the IgG one, SARS-CoV-2 antibody IgG to spike semi-quantitative. Yeah, that's the right one. Yep. So it's the IgG one. Also, does he look to see the antibodies at a certain level or just a general downward trend? So the level does seem to correlate with severity. Your total spike is 645, while the regular semi-quantitative spike is 4.36. Last year, these were 859 and 39. Interestingly, my SARS-CoV-2 antibody IgG nucleocapsid is negative. Last year it was positive, and I expected it to still be positive since IgG persists. Yeah, so the IgG is a longer lasting thing, but often, usually, the immune system, if it hasn't been stimulated by a vaccine, which comes with very powerful adjuvants, which are basically toxic chemicals that make the immune system stand up, pay attention, and like be extremely alert and say, I need to react to this really strongly. In the absence of that kind of like overstimulation, the B cells don't usually pump out antibodies lifelong, although they can make them at any time. At the drop of a hat, they'll start producing them if you get exposed to the antigen again. So that's the way it's supposed to work, because your blood would just become sludge if you had antibodies to every single thing you've ever been exposed to floating around all the time. But some things, in some cases, you just get lower levels, and sometimes after an infection, typically the IgG often does persist for years. At least low levels. But I would consider this a good thing that it hasn't persisted in you. It means that you did not respond in a kind of like a hyper-inflammatory way. So it's probably a good thing that it didn't persist. And the levels seem to be pretty low in you. The 645 and the 4.36 are pretty low levels. So you could try to get them lower. And just see if you can get them lower than that with augmented NAC and nattokinase. Angelina says, what about brain function, memory, and so on? And the other thing that you could do, sorry, going back to Joshua, is if you wanted, you could check the S1 subunit in the monocytes as another kind of secondary indication that spike is actually gone from your body now. And unfortunately, in Italy, they have this, the same group of people that developed augmented NAC developed a spike protein test in the urine. And unfortunately, we don't have any of that here in the US. We don't have direct spike protein tests, blood or urine or whatever. If we did, that would be the number one thing, right, that you could check to see if you have spike in your body. We have indirect tests like this antibody test and the S1 subunit test, which is a lot more expensive. So the antibody test cash pay is like $100. The S1 subunit from IncelDX is close to $500. Angelina says, what about brain function, memory, and so on? How would we approach treatment? Not vaccinated, but had COVID 16 months ago and had amnesia after and ongoing, I think. So the number one thing, again, is to go and take the 3-day lightning process seminar. And that's what I would try first. And then everything else, right? The entire long COVID protocol, and you can get that at mygotodoc.com. It includes lifestyle stuff, supplement stuff, and medication stuff. One of the things that seems to work well, obviously, ivermectin is the place to start, right? That's number one. You got to start there, and it can fix the brain fog also, right? Even though it doesn't pass through the blood-brain barrier. And That's because it's dealing with inflammation in the body, and that inflammation may be passing through the blood-brain barrier. So ivermectin, the anti-inflammatory kind of supplements and diet approach, and getting sun in the morning and late afternoon for the infrared, which passes through even your skull and goes into your brain and powers your mitochondria. Avoiding toxins, getting rid of glyphosate from your body, and binding the spike protein. Maybe, I would certainly recommend checking the spike protein antibody levels, as mentioned earlier. And if those are low, then track them month to month as you do things that will presumably get them down, like augmented NAC and nattokinase and perhaps ivermectin. So you try ivermectin, LDN, for a couple of weeks. You try antihistamines also. Antihistamines can work fantastic for brain fog if it's a histamine-related brain fog and amnesia. So try that. So the Claritin and Pepcid, for example, and if the once a day normal dose doesn't work, try it twice a day. Try it 3 times a day. Try Benadryl or maybe Phenergan or promethazine. And if the antihistamines aren't working, then you might try Namenda, which lowers kind of glutamate levels. You can try a low glutamate diet as well, and you can try just breath work and meditation can help to rebalance that the GABA and glutamate kind of in the brain. Other things would be like ashwagandha and as well as shilajit can help balancing glutamate and GABA. And so a lot of the people have brain fog due to imbalance between glutamate and GABA, these two neurotransmitters, too much glutamate essentially. But Namenda can be great at helping if the supplements aren't good enough or they don't do enough. Vanessa says, if one now has horrible seemingly seasonal allergies and inflammation, i.e. wake up sore in the morning until get up and get around, what are the best 3 things to reduce inflammation? Here to keep taking Zyrtec, for example, can make one worse with continuous use. So the thing I like best would be probably black seed oil from theblessedseed.com. Get the organic one. That, and then again, if it's seasonal allergy kind of inflammation, if it's related to spike protein, then you need to get rid of spike protein. So it kind of depends on whether it's related to spike protein or not. If it's related to spike protein, then it's extremely important to take augmented NAC and nattokinase. And then maybe black seed would be third. But, saying what are the best 3 things depends on you, right? So if I check your blood tests and I find that your vitamin D is in the tank, if it's really low, vitamin D, then vitamin D would be number 1 probably for you to reduce the inflammation. You would have to take vitamin D and vitamin A to balance it out. But you would also have to take vitamin E and vitamin K2 because you wouldn't want to get deficient in those. But the main thing would be what's low, which could be vitamin D. If you do your blood tests and your zinc is like extremely low, then I might tell you to take zinc. If you do your blood tests and your magnesium's on the lower end of the range, then I might say magnesium is like extremely important. In general, I think everyone needs to have some supplements unless their diet is like super optimized, right? Like you would have to be very strict about what you eat, very regimented in order to get all of the nutrients that you need every single day at optimal levels. Nutrient levels in our food have gone down over time. And so you need to really be hyper focused on getting like a perfect diet in order not to need to supplement. So the things that people commonly need to supplement are magnesium, vitamin D, vitamin K2, probably a mineral supplement like a C mineral supplement, and the other fat soluble vitamins go with it. So like vitamin A, D, E, K2 are probably all important to supplement with. So it kind of depends, right? The answer of the top 3 things would depend on you and whether you have any deficiencies that can be identified and whether or not you have spike protein. Felicity says, but then, if it's not related to spike protein and you don't have any nutritional deficiencies, and then you're left with things that help you deal with inflammation in terms of supplements. So in terms of like the underlying issue, again, you would want to address like toxins in your body. So for most of us, it's going to be things like glyphosate, pesticides. So all organic, eliminate those, and an anti-inflammatory diet, remove things that are triggering your symptoms. Lightning process helps. Again, with any symptom, it doesn't matter what it is, including allergies. It can help you get rid of allergies. So anti-inflammatory diet, like address your diet and make sure there's nothing inflammatory. Get rid of modern wheat completely. It's just really bad. It's very inflammatory. After some time, you may be able to tolerate ancient wheat like spelt or einkorn, especially if it's sprouted and, made properly into bread in like a traditional way to eliminate phytic acid. Which is an anti-nutrient, which prevents the absorption of nutrients. But yeah, so anti-inflammatory diet, removing toxins like pesticides, and then assuming your nutrition is optimized, which it probably isn't. Most people's is probably not optimized. But assuming it is, then you could use some herbs to help, speed up the resolution of allergies and inflammation, which would be things like black seed, and also turmeric, maybe, right? Maybe ashwagandha. Also, pine bark extract is another good one. Quercetin is another good one that we often use with spike protein related stuff. These all have antihistamine effects. All right, Felicity says, do you have any links to long COVID functional medicine practitioners in London? I'm struggling to find LDN for a vaccine injury resulting in LADA type 1, PEI, and biliary dysfunction. Yeah, so I think people have trouble finding practitioners in England. The only one that I know of, I don't know if she's in London or somewhere else, is Tina Piers, and she primarily focuses on the MCAS cohort of patients with long COVID, and she really, I guess, thinks everyone with long COVID has MCAS. That's her approach. And, the problem with this is that a lot of people probably do have MCAS, but maybe not everyone does. But the people that do, if they go to an MCAS-focused practitioner, the people with MCAS will get better, and the people who don't get better will just kind of give up and be like, oh, you're not helping me, and go find somebody else. And so there's this self-reinforcing belief that your approach is working because the people who come back and give you positive feedback, right, and the people who it doesn't work for usually just don't come back, right? They just disappear instead of coming back. And they might give you negative feedback a couple of times, but if you're still not able to help them, they might just disappear and kind of like fall off your radar. And you just continue to get positive feedback from people that your approach is working for, and so you become more and more convinced in your specific approach. So yeah, I don't know of anyone, but who would be able to prescribe LDN for you. Unfortunately, I don't know how you would get that in London. Tina Piers might be able to prescribe it. Some people, she might be willing to. Maybe you'll have to like fly in for the first visit, and then maybe she'll be able to do follow-ups via Zoom or something. So check out Tina Piers. Take the lightning process seminar. It can help with those. Joshua says, is elevated Epstein-Barr virus early antigen a cause or effect of my long COVID neuropsychological issues? My early antigen has been elevated for the last 18 months. Acyclovir Truvada did not lower it. Trying Valtrex now. Also have low CD57, so is it just immune dysregulation? Yeah, this reminds me, I came across something, I'm trying to track it down. There was somebody had tweeted or something about a medication that works a lot better than Valtrex and acyclovir, but I can't figure out where I read that, and I can't remember the name of the medication. So if I find that, I'll tweet it out. Yeah, it's possible that EBV reactivation can cause neuropsychological issues, and it's also possible that it's not related. So again, the number one thing is try the mind-body kind of approach. Take the lightning process. It usually resolves neuropsychological issues very quickly. And then you can try to get to the bottom of if your EBV remains elevated, why that is. But also check the antibody level. I don't remember, maybe you're the person who had checked the antibody level. I'm not really paying attention to who did what here. No, yeah, that was you, right? You did check the antibody level. Yeah, it was already pretty low. So you have checked it. Again, I told you earlier, maybe consider getting the S1 subunit test from IncelDX. And if you haven't done everything like augmented NAC and nattokinase and everything to lower it, then go ahead and try to lower it even further than it already is and see if you can eliminate more spike protein from your body. And then, yeah, maybe explain exactly what the neuropsychiatric issues are in more detail. But if you haven't tried addressing glutamate and GABA imbalance, then that might be an approach to try, like I was saying earlier. Maureen says, what dose of ivermectin do you recommend? Also, COVID attacked my pancreas. Now I have an insufficient pancreas, using Creon for that. The enzymes work, but do you think it's okay to take the ivermectin? Yeah, so I think Creon and pancreatic enzymes may be kind of like a crutch and maybe not a great thing to rely on, certainly not long term. Your pancreas can recover, and it's just a matter of eliminating the spike protein and other toxins and giving yourself all the nutrients that you need to recover and avoiding an inflammatory diet. It should be, like, there's no reason that ivermectin would be contraindicated based on the information you put here. And the standard dosing is you start at 0.2 milligrams per kilogram daily for a week, and if that's not working to improve your symptoms, then you double it in the second week and triple it in the third week if it's still not working. And then, maybe give it a try for, at the dose that's working. If you find a dose that works, just stay on it. And if you get up to the top dose at the 0.6 milligram per kilogram dose, in the third week, if it's not working after a couple of weeks, then you may not be able to benefit from ivermectin. I do remember one person who kept taking it for a month and then they got better, right? They had to keep taking it for an entire month, and then they were like, oh my God, now I'm a lot better. So, but if you're not better after about 30 days or so, then you can probably stop it and try something different. Peace Samir says, I had labs done from my go-to doc. Will they tell me if I have some vitamin deficiency? I'm having terrible pain and head and neck pain, as well as weakness and dizziness, gut pain. Yeah, so the labs that we usually do for long COVID, yeah, they are looking for vitamin deficiencies. The common ones that would be implicated. And, but yeah, for the pain, I highly recommend doing the lightning process. Mind-body approach is very, very effective for pain and weakness and dizziness. I have MTHFR positive for one copy of the C677T variant and one copy of the A1298C variant. Do I need to take folate supplements? So the best way to address MTHFR, like you have, is to get Chris Masterjohn's free MTHFR protocol. It's like a 3 or 4 page protocol. And he has a free choline calculator where you upload your Ancestry.com or 23andMe genetic information file, and it calculates your choline requirements. So there are a number of different things that you take for an MTHFR issue. And so they include trimethylglycine and choline and a few other things. So that you can find that in his free MTHFR protocol. And hopefully we can find that where it is on his website. He has a Substack as well as another website. So yeah, if you just Google MTHFR Chris Masterjohn, you'll find a bunch of links on Google. There's one that says start here for MTHFR and methylation. My free MTHFR protocol, this 7-page quick guide. Yeah, So it seems like it's just up there. Well, I don't know if it's all there. I mean, he gave it to me. Yeah, so it looks like you just have to subscribe to his Substack, and then you get a welcome email that includes the MTHFR protocol. And his Substack is chrismasterjohnphd.substack.com, CHRIS Masterjohn JOHN PhD.substack.com. All right, so that's what I would do for MTHFR. And it's great because his protocol tells you, okay, if you want to like get all your nutrients from the diet, this is how you do it. And if this is too much, then take these supplements. Felicity says, what is olive leaf's role in long COVID? Should you take serrapeptase and nattokinase together or introduce one first? Yeah, olive leaf extract is great. I've found that it's quite beneficial. I think it's having an antiviral effect. I mean, it certainly has anti-inflammatory effects. But I don't remember what it was specifically about it that was special for long COVID. I remember looking it up once, but yeah, I do recommend olive leaf extract. Should you take serrapeptase and nattokinase together or introduce one first? I would introduce nattokinase first and then the serrapeptase. Have you heard of herbatonin, a plant-based non-synthetic melatonin for long COVID? I have not heard of herbatonin. I would have to look into it more to see whether it's actually effective in human beings or in mammals. But it sounds promising. Yeah, so with melatonin, we recommend very high doses. And I don't know that there's anything wrong with synthetic melatonin. I do generally prefer, just from a philosophical perspective, natural, things, natural solutions. So yeah, thanks for pointing herbatonin out. I'm gonna look that up. That sounds interesting. Victoria says, what are your thoughts on sourdough? Yeah, I think sourdough is fantastic, especially if it's made with spelt or einkorn or kamut, any of the ancient wheat varieties that predate, modern wheat, which is extremely hybridized and it's a lot hardier, and it's hard on your digestion as well, and it has a lot more gluten in it. So the modern wheat is this modern dwarf wheat that it's like a Franken wheat, right? Like it can't survive on its own in the wild. It has to be kind of like held up on crutches and stuff in order for it to survive in the fields, and it's very, very high in gluten. So it's optimized for agriculture. It's not optimized for human beings, right? It's optimized for the bottom line of big ag, and not for your gut. So I think that not everyone, maybe not everyone can tolerate wheat in the world, right? Like every ethnicity or every human being. It's possible that even the ancient wheat may not be optimal for your genetic makeup, but I think for most people, if they get traditionally made sourdough, which is not an easy process, okay? I mean, I've seen my brother and my mom make sourdough bread, and it's like a very intensive, I mean, you're like kneading it every 3 hours or something for like 2 or 3 days before you can make one loaf of bread, which if you have like a bunch of people eating it is gone in like 15 minutes. It's fantastic. It's the best bread you've ever tasted, okay, when you make it right. But it's very, very time intensive. So yeah, I think that if you're going to eat bread, then make it spelt einkorn or kamut, and make it a sprouted flour, so soaked in sprouted flour, and then also make it sourdough, and then it'll probably be fantastically healthy for you. Carol says, but some people may need to avoid all wheat, initially. until they've kind of healed their gut and gotten a little bit better, and then maybe then they'll be able to tolerate sourdough bread. And a lot of these, the tolerance is also kind of psychological, right? So again, the mind-body thing can also probably help with, it does help with food intolerances, including wheat intolerances. Carol says, I've been taking cytokine suppress since April 2021. I'm doing well using ivermectin twice a week along with the supplements you recommend. Do you think it's time to start weaning off the cytokine suppress, or is it safe to continue taking it as a preventative measure? I'm a little concerned about removing things from my regimen as I do have a IgG deficiency and just turned 70. Long COVID still dictates how I lead my life, but just completed a 10-day cycling trip on an e-assist bike in Germany and France. My pulmonologist thought I'd come back sick, but I didn't. Took a couple of weeks to recover my energy, but I'm back to pre-trip. Thank you for devoting your energies to solving the mysteries of this virus and taking on the establishment. So, yeah. I would consider getting tested, to see what, if you've been on zinc for a couple of years or, a significant amount of time, then you need to also supplement with copper. So these protocols, if you're going to be on them for a really long period of time, then you need to make sure that they don't lead to other deficiencies. So, I assume you're taking like vitamin C and vitamin D and zinc, and maybe quercetin and stuff like that. So if you're on taking D for that long, you need to make sure you get vitamin A and vitamin E and vitamin K too, as well. So, but yeah, with the cytokine suppress, your long COVID has not completely resolved yet, and part of it could be a mind-body issue, right? The mind and the body kind of get stuck in patterns and in symptom patterns. Even, it's possible that the spike is gone and the clots are gone and everything's gone, and you're just left with the same kind of neurological pattern of illness that you've gotten stuck in. So definitely do the lightning process. And I think they're actually based out of the UK. So you might be able to do it in person. And you can consider trying to taper off the cytokine suppress. I don't think that it's absolutely necessary. I think that it's fine to stay on it. But eventually I would want you to be able to come off of it. Like, you're not meant to stay on these things forever. You're meant to use them to get better and then come off of them. And so that's what I would aim to do. The things that you might stay on forever would be nutritional supplements, right? But not herbs. All right, so all right, so I think we'll stop here. Thanks everyone for watching, especially this early in the morning. There are as many people as we usually have, if not more, watching live. So really appreciate that. Please like and subscribe and share the content widely. And yeah, check us out at Facebook if you use Facebook. I don't really use it, and I don't recommend certainly overusing any social media, including Twitter. I need back on my Twitter use. Social media is not a good place to be most of your day. Get outside. That's where you should be. Get outside in nature as much as possible. I read an article that was really interesting about how one of the benefits of forest bathing is that the light goes through the green leaves and kind of like filters, and it changes the wavelength, so you get a lot more green, and it filters out some of the other wavelengths of light. And it reminded me that I also read something about how green light is used to treat migraines. They just shine green light on your face. And it made me think that it's really unnatural to be indoors with like white or beige walls everywhere all the time, like all around you. The light that is coming into your eyes, that bounces off those walls, those very light colored walls, is just like an unnatural light. And it's something that makes me think of like snow blindness, right? Like when you're out in the snow and you're just looking at like bright, dazzling white all the time, you go snowblind. So I don't think most people are optimized for being in indoor environments. And that's just one of the reasons, right? The light is abnormal. So I do recommend getting like tons of plants in your house and maybe even painting your walls like a light green. just to get a healthier wavelength of light into your eyes and onto your body. But nothing can, substitute for going outside. There are scent molecules that are released by all the plants and the trees that have beneficial effects on your immune system. The oxygen, the air is fresher, the light is better, and yeah, it's just people need to spend as much time as possible outside. And also, you can ground yourself outside. You should also ground yourself inside, but you can naturally just walk around on the earth. You can also get grounded footwear. So anyway, thank you everyone for watching, and I will see you next time. All right, bye-bye.